It is time once again to visit clinicaltrials.gov. And the reason for visiting clinicaltrials.gov for me personally is because of information I come across. In my last video, as I mentioned, this is not a site that I come to often. Very rarely have I visited this. Probably the last 7 years, not more than 5 or 6 times. Everything I need to learn, I can usually find it on the FDA website, or if not there, that rarely happens, it's not there, then on the CDC website. But this website, which is maintained by the NIH, the US National Library of Medicine, and this data is collaborated on and provided internationally, as it mentions. So, because this is continuing to be the subject, which has been in discussion for over 2 years now, and quite obviously, it is one to be researched. So the search will automatically populate with the suggestions once you enter it in the search bar, just like it happens in any search engine. So not specifying anything about COVID-19, just COVID-19. And let's select a country. Let's select the United States. I could select state, city, and all that as well, but just COVID-19 United States. Search. 1,627 studies found for COVID-19 United States. Now, if I was to do that for around the world, you can imagine how many results there would be. So I believe the doctors who frequently refer to this website, they would specify even the city, the results for which they are interested in. They can if they want to. This is a much bigger search. So you can look at the first 100 results on the very first page. And of course, as I mentioned last time, according to status, you could filter: not yet recruiting, recruiting, enrolling by invitation, active, not recruiting, etc., etc. And the labeling system is very good on this page. But earlier on, just, well, before I go there, let's look at locations. Boston, Massachusetts, Wilmington, Delaware, Milwaukee, Wisconsin, New York. This is Icahn School of Medicine at Mount Sinai, New York. Massachusetts General Hospital, that's Boston, Massachusetts. And a lot of different locations, obviously. When you have over 1,600 studies, you have a good spread. But there's a better way to find locations. If you go to the map, now here's a map. So this is a world map. This would be the United States. And here is, it says colors indicate the number of studies with locations in that region, from least, which is in light or kind of a neon green, not really neon green, it's light green, to red. And you look at the map of the United States, and where do you find the most red? Right here, 319, and they're on the west coast, 410. Up in the northeast, 337. So This is to indicate the number of studies. So let's pick down here. And this is Texas. 319 studies. So the map links to the page where you have the list of studies. And you can look at every location where the study is going on. Texas. This is in Austin. In Dallas, Louisville, Austin. So there's some familiar names. Methodist Dallas Medical Center, Dallas, Texas. There is Baylor University Medical Center, Dallas, Texas, United States. And Methodist Dallas Medical Center, Dallas, Texas, United States. And what would you like to look for? Anything that you want to is before you. You could look for anything. So let's look at here. This is excellent. Number 7. Completed has results. Hydroxychloroquine in the prevention of COVID-19 infection in healthcare workers in Baylor University Medical Center, Dallas, Texas, United States. Let's take a look. It has results. Recruitment status completed. First posted April 3, 2020. Results first posted August 20, 2021. Last update posted August 20, 2021. So almost the whole month of April, May, June, July, and almost past the mid of August. Almost a 5-month period for the study. You could go to study details through that tab. This is the brief summary. Actually, I'm going to post a link for this particular study and the page. So obviously you could go through the details, which I would want you to do if you're interested. So brief summary, what does it say? Let's see if I can magnify this. Of course I can magnify this. And the word I was thinking of last time, this is a responsive website. So the text graphics adapt to the size of the screen. Study description, brief summary. In order to assess the efficacy of hydroxychloroquine treatment weekly for a total of 7 weeks in the prevention of COVID-19 infection, 360 healthcare workers with high-risk exposure to patients infected with COVID-19 will be tested for COVID-19 infection via nasopharyngeal (NP) swab once weekly for 7 weeks. Of those, 180 will receive weekly doses of hydroxychloroquine for the duration of the study. Subjects who opt not to receive the study drug will form the control group. Excellent. COVID-19 drug hydroxychloroquine phase 2 trial. Study design, interventional, clinical trial, actual enrollment, 221 participants, allocation non-randomized, intervention model, parallel assignment. Although I'm reading these things, it doesn't mean I understand every single thing in detail. So that is up to me to look more into how studies are conducted, but I'm just giving you an introduction. Masking, none, open label, primary purpose, prevention, official title, a prospective clinical study of hydroxychloroquine in the prevention of SARS-CoV-2, COVID-19 infection in healthcare workers after high-risk exposures. Same thing as was mentioned earlier. These are the details that are recorded. Tabular view, how's that different? Okay, this is the tabular view and study results. Hydroxychloroquine in the prevention of COVID-19 infection in healthcare workers. Sponsor Baylor Research Institute. Information provided by a responsible party. And, of course, there's a lot of details to go through that is collected over a period of 5 months. Limitations and caveats is also mentioned here. The trial may be underpowered as recruitment was forced to stop early at 221 instead of 360 because of the demand for and subsequent shortage of HCQ in March 2020. Our study participants were young and healthy compared to other prophylaxis trials, which may partially explain the low rates of COVID-19. How much more transparency does one want? Result, point of contact, name, title, Peter A. McCullough, MD, MPH. Organization, Baylor Scott and White Research Institute. Phone, email address. I'm not going to post a link to the phone and email address on YouTube, of course, but when you visit the page, you have an active link, and you could make use of that. Let's zoom out, go back once more, and once more. Let's just go return to list. So you pretty much have the idea now about how this works. And you might be familiar with some of these hospitals and institutes. Here is something interesting. Not yet recruiting, number 14, Selenium, as a potential treatment for moderately ill, severely ill, and critically ill COVID-19 patients. Christus Good Shepherd Medical Center, Longview, Texas, United States. Selenium is good. It's a good mineral. Someone wants to conduct a study. This is the way to do it. Let everyone benefit. Just imagine it brings out the kind of results that opens prospects for people to just use selenium supplementation. Let's see here. There is a box in gray. The safety and scientific validity of this study is the responsibility of the study sponsor and investigators. Listing a study does not mean it has been evaluated by the U.S. federal government. Know the risks and potential benefits of clinical studies and talk to your healthcare provider before participating. Read our disclaimer for details. Recruitment status, not yet recruiting. First posted May 3, 2021. That has been a long time. Last update post is posted August 3, 2021. So, who is conducting this study? Who are the collaborators? Who is the sponsor? Study description, brief summary. Given its antiviral, antioxidative, immune-enhancing, cytokine-modulating, and anticoagulant properties, the investigators hypothesized that selenium infusion at supranutritional doses for moderately ill, severely ill, and critically ill COVID-19 patients will prevent further clinical deterioration, thus decreasing overall mortality and improving survival. To test this hypothesis, a prospective single-center Phase 2 trial is proposed to assess the efficacy of selenium in hospitalized adult patients with moderate, severe, and critical COVID-19 infections. So keep in mind there's only a single center that wants to conduct the study. If there were other centers, other hospitals, which were of the same idea, they could have collaborated. It could be a multi-center study, not this one. Drug Selenium as selenious acid, other placebo, phase 2. Of course, I'm not going to go through all the details. That I would leave to you to do. And I'm just going to post the one link where it opens the page for this page. It opens the page for studies going on in the United States, in Texas. And then it's up to you to go through the study that you want to go through. And that will be all. So now I've spent some 16 minutes on this video, and I think this is a pretty thorough demonstration. And you should have a very good idea. What I'm doing, you can do too. At least I'm telling you how I did it. So this is it, and I hope this is to your benefit. Thank you for your time, and bye-bye.